while they're coming up here, I've known a few of these folks for a little bit. I became familiar with Texas Medical Management a few years ago. I think their headquarters are in Austin, right? And think direct contracting for surgical bundles. I've met George recently with L&F Distributors, and I want this guy in the back to raise his hand, Joe Lomantia, who is L&F Distributors, but he is, and his organization is one of the more proactive organizations as an employer and as a possible answer for employers looking for a different way to do business. And George has been, you have a hospital background.
Yes, sir.
I know, so he knows where the skeletons are buried. And then last but not least, Andy Martinez, who I've met some of these folks from the head up, you know, on Zoom, so I'm getting to recognize folks' whole body here. So I've known Sean for a little bit. They're doing great work, but I like what they're doing, so I thought it's worth hearing. You probably have a net promoter score of what, 98?
I don't know.
I don't know.
We're transparent about it.
Yeah.
It's 87.
All right, so it's your show, guys.
Today we're going to tell a story about how a direct contracted provider can work very closely with a self-funded employer health plan that is very interested in not only saving money, but improving the quality of care that's delivered to their members, and then also tacking on top great service. And then over this span of 7 years now, we'll show what we've done together, and then we'll get to see the results. So my name is Sean Kelly. My brother and I founded Texas Medical Management in 2015. My brother's a pediatric reconstructive microsurgeon trained here at Baylor College of Medicine, and we both worked in Dell Children's and the Seton system or the Ascension system in Austin. I ran the neuroscience service line on both the pediatric and adult, got out just in time before I probably would have had some lasting damage. And so when I got out, we decided we could fix this part of healthcare. That is, we understood surgery well enough that we knew how to choose the doctors, vet the doctors, to get the quality that we knew is out there, but lay people aren't able to discern. And then at the same time, we knew that we could raise the service level tremendously. And then the last, but probably easiest part of this was to cut the cost. And that is, we're going to provide the right care with the right provider at the right side of service, and it almost always ends up saving tremendous amounts of money. So, George works for L&F Distributors, Andres as well. I'll give a little bit of history about Texas Medical Management, and then we'll hand the keys over to these guys. We're going to run through a little short deck, a couple minutes, and then we think that's going to set the table for a panel discussion that hopefully you'll find very valuable. So we started, as I said, in 2015. We grew the business. We're from Austin. We've been in the medical community for about 10, 15 years in Austin. So my brother, as a reconstructive surgeon, knew all the really good surgeons because he was right across the table from them while they were resecting. And so we used that as our first initial go. So we grew really quickly in Austin in terms of scope and depth of service. And so we were attracting some clients. Austin's kind of a strange community in terms of self-funded employer health plans. There's a whole lot of government. There's a whole lot of public sector. There's some private, but you know what? A whole lot of those decisions are made in Silicon Valley, and IBM makes them in New York. So there's not a whole lot of self-control. So we started talking to employers outside the market. And so a lot of our customers were flying in. A lot of the patients were flying in or driving in. So in 2018, we moved to Houston. My brother and I are both sixth-generation Houstonians. My sister's a pediatrician here at Texas Children's. And so we knew we needed to come to Houston. We love Houston. I grew up in West U, so it's a natural for us to come here. This is a really big market with a ton of opportunity. And when I said what I said about Austin in terms of self-funded employer health plans, it's the exact opposite here. So I think it's a really, really great opportunity. And Chris, I'm glad you guys have put together this organization to bring this kind of information to employers in the market. And then just most recently, we expanded to Dallas and the Rio Grande Valley. So as I mentioned, we vet the surgeons, but to ensure the quality, we also measure our outcomes. So we do patient-reported outcomes on every single patient, and we collect an NPS score. And, oh, there's a typo. It's 97, not 87. I'm joking. It is actually 87. It is actually 87. I'm still very proud of that. If you look at hospitals out there, they're like in the 20s. Yeah. Pharma's like in the 5 or 6. I mean, there's not very good service in healthcare for a lot of different reasons. It's not because people don't care. It's just I think we are working in a mixed-up industry. So next slide. So next I'll hand it over to George and let George tell a little bit of a story about how L&F, their journey to today.
Yeah, sure. Thanks for having us. I'm George Brown. I'm with L&F Distributors. And a little bit about us, just for some context. We're in the beverage distribution business. So anybody in the room who likes beer, we're your guys. We've got a total of about 1,500 employees in our organization, 12 warehouse locations distributing in 35 counties in Texas and New Mexico. Most of our locations are actually in South Texas, West Texas, southeastern New Mexico. We're headquartered in McAllen, Texas. So we have warehouses in McAllen, Harlingen, Laredo, Corpus Christi, El Paso, all the way up into Roswell. And then we have a wine and spirits division that has operations here in the Houston area, also in Austin and in Dallas and Albuquerque. The slide behind us kind of talks a little bit about our journey. So we've been at this for quite some time, and I think that's one of the key takeaways that we've heard in some other presentations, and I'll reiterate it, is that when you're working to revolutionize your health plan, it's not something that happens overnight. It's not a lightning in a bottle type of an experience. It's a marathon. It's not a sprint. So it's been a long journey for us. We really started on the health side, I guess back in 2013, and there's a strategy and a methodology behind kind of what we've done over time. The first thing was really getting into the right type of an arrangement, the right chassis, if you will, that will allow us to enter and transact into direct contracts. And direct contracting is very central to our strategy for a lot of different reasons, but how it ties into the topic today of the triple aim is if you think about the current healthcare environment, let's talk about the unknowables, right? If we have an employee who is receiving, say, surgical care, and they're just using their network card cost, you're basically standing at a roulette wheel is the way I like to describe it. You don't know what that's going to cost until after the fact. It's highly dependent on where they go, who they're seeing. From a quality perspective, again, it's another turn on the roulette wheel. Obviously, variation in terms of quality out in the marketplace. It's going to be largely dependent on who they see. You have no control over that. And the same for experience, just like quality. I mean, it's healthcare in general. I think the NPS score last time I saw was in the 30s. Competes pretty closely with cable companies. So, some are good, some are bad. But as an employer, in the current status quo environment, you have no control or influence over any of those. But when you enter into direct contracts, well, now all of those things become knowable and become more easy to influence. So when we partner with Sean and his crew at Texas Medical Management, it's completely reversed. We know the price, we know it up front, it's transparent, it's all-inclusive, no balance bill guarantee, the price is the price. We understand the quality, they're measuring quality, they're collecting patient-reported outcomes, they're collecting NPS, all of that information is shared with us. So we as employers feel like we're in a lot more control and have a lot more insight into what's happening in the care that the members are receiving and ultimately how much it's going to cost us. So as we've gone through this journey over time, we've implemented different strategies and different solutions, and I sort of just put them on a timeline just so you can visually see. But all of these solutions that we implement, whether it's direct contracted surgery centers, direct contracted imaging centers with our friends at Green, to whatever that solution may be. On-site clinics for chronic disease management, these are all in direct contracted type of a relationship. And we do that, specifically for a reason. And when we do that, we're getting so much value in return that all of those services we offer for free to our employees. So our employees, if they utilize our contracted clinical partners, they get their surgery for free. They get their imaging for free. They're getting chronic disease management for free. They're getting telemedicine for free. They go to urgent care for free. The list goes on, and they're all behind me. But the real takeaway here is that it is a marathon. It's not a sprint. And don't let it be overwhelming. We heard this earlier today. Just start with something. Imaging could be a great solution. Get started on imaging and see how that works. And then over time, start layering in other services. And over time, you'll see this huge compounding effect. So we'll talk a little bit about utilization. There was one question in one of the panels earlier around utilization. And this is something that we completely obsess about at LNF. And when we talk about utilization, some people use different terminology, maybe engagement, but these are going to be folks, this is surgery specific because we're here talking with Sean about surgery. It's the percentage of people who would qualify to get a surgery at a facility like Texas Medical Management who actually utilize it, right? So all these clinical solutions that you put into place mean nothing if you can't get people to use them, right? So we obsess about utilization, and we've been on a utilization journey for several years. In the surgery world, really starting in 2017, 10% utilization, which is probably pretty common. Sometimes it's a lot less from what we see. But by having an intense focus on utilization, you can see how that's climbed over time. And so in this past year, 2022, with our direct contracted surgery centers, we were at 86% utilization, which we're extremely proud of. You start talking about how that translates in terms of savings, and I'll just put it up there, right? So when you look at, when we're able to get our members who need surgery to Texas Medical Management, and you look at what that would have cost us had they not gone to Texas Medical Management. Just in 2022, it was over $700,000 a year in savings. So significant cost savings to be had. But again, that's really the probably second or third most important thing. The most important thing is that we understand that they're receiving really great care and they're having a great experience. I'll also point out, based on our markets where we are, in achieving that level of utilization, only up until recently have we had a Texas Medical Management option in the Rio Grande Valley. So all of these members have traveled to receive this care. They've traveled to Austin, mostly Austin, sometimes Houston, but mostly Austin. And so even with traveling folks to have this done, we've been able to achieve over 80% utilization. And Joe in the back likes to tell a story that I get fired up every time I hear, and I'll probably not do it the same justice that he does. But to give you a sense of how much cost savings is at play here, we can take an employee and their spouse from our El Paso location, and let's say they need a knee surgery. So we can take the employee and their spouse, we can put them on a plane, we can fly them to Austin, Texas, we can pick them up at the airport in a limousine, we can put them up in a 4 or 5 star hotel, pay for all their food, all their meals, all their travel, all of that. We waive their copay, we waive their deductible, make it free for the member, and then we even give them $1,000 cash incentive, and we're still saving about 30% than what that procedure would have cost at the local hospital in El Paso. So we're pretty proud of that. Some of that's font's a little grainy, but we're beer distributors and not content creators, so I'm just going to embrace that. But so this is our per employee per year cost. So you just talk about all of these strategies, including surgery, that we've implemented on our plan year over year. This is our healthcare costs on a per employee per year basis. And you can see that it's remained relatively flat and stable over the last, a lot of years.
10 years.
10 years, right? The line is compared to industry. It's not uncommon that employers, self-funded employers of our size are receiving double-digit increases every single year, unless, you've got a smooth-talking broker that can get it down to 8%. Either way, it's unacceptable. That's how we compare to industry, and so we're very, very proud of that. And then in return, we're able to share those savings back with our employees. Slide's a little busy, but our costs have remained very stable over the last 10 years, and in return, we've been able to lower premiums to employees, keep their premiums stable as well. So we're able to return those savings back to the employees and make it a really affordable plan with all the free options embedded. So I'll stop there and we can have
Thank you,
more of a
George.
discussion.
Yeah, so I think that's a pretty clear picture about the results. What Texas Medical Management does by bundling high-quality surgeons into surgical bundles and then delivering those to a client like LNF. We take care of a portion of that savings, an important portion, because what you'll find is that when you have successes with these surgeries, oftentimes that means a whole lot to an employee. So, Andres, I saw that beginning number in like 2017 at 10%. Give us a little bit of a history. I know you've been around in LNF and HR benefits since well before they got into self-funding.
Right.
Tell us a little bit about, though, after they got into self-funding and then they started layering in these direct contract provider options, and how did you and your team get these numbers?
So it's hard. Because it was unreal at the time, right? 2017, you're telling an employee or having all these meetings, open enrollment meetings, like, hey, we added, Texas Medical Management, you can have free surgeries, outpatient surgeries, and we'll pay for all the travel and we'll give you $1,000. And they're like, yeah, right. Like, there's no way I'm going to trust that person over who's down the street, right? So then year over year, explaining the same thing over and over, even to the point where I would tell them, look, if you go to use your Aetna card, that 20%, right, of that copay, like, you have to pay for that, and we can get rid of it by going through TMM and Sean's group. And then we added care navigation, and that was key, right? And then we added that element of like, look, call these people, call our care navigation team. They will explain all the little ins and outs that you don't know that's not in that benefit summary. It's in the guide, but they're not reading that, right? So then we told them care navigation, here's the number, call them. They will, if you need someone local, right, just in the Aetna network, they'll tell you where to go. But then they'll also tell you, hey, if you need a surgery, I can get that done for you for free. I mean, it took years and years and years to get the employees to catch on. Fortunate for us, the loudest, biggest loudmouth employee you can think of, and I know everybody, you already have a name in your head. That person was the first one to go to get a surgery. And water cooler effect, and it just spread. What? I can get a surgery and get $1,000? Well, you're going to get a really good surgery, and then you're going to get $1,000, right? And then, Sean collects all the information of what the outcome was for the employee, and you do it in a span of time, right, to understand. So was it easy? No, it was not. As a self-funded plan, we kept adding features to our insurance, right, whether it be telemedicine, care navigation didn't come right away, disease management, a wellness program. So we just started adding and adding and adding. And as we went adding more things, they're like, oh, this is normal. This is what it is now. So now I'm able to have open enrollment meetings and really tell them, hey, remember back then when we added this, here's an additional benefit to that. And it's all zero cost to you as an employee. And we also explain that, look, we understand that insurance is expensive, going to the hospital is expensive, doctors, et cetera. I was like, we know that what you're getting deducted out of your paycheck is not ideal, right? Even though we've been keeping it very low for a very long time. And we tell them we want to offer more, which is zero cost benefit to you.
Yeah, and I think one of the things that's really important is that they would get the numbers. This is LNF. They would get the numbers from their care navigation TPA each and every quarter that would show the number of opportunities, outpatient surgeries that were done, claims that came in, and then how many of those actually were sent through care navigation to one of the contracted facilities. And each and every quarter, they thought of new ideas, like
Right.
know as you go, and there's communications that happen
Just so you
during.
know as you go are flyers that we put in the bathrooms.
Yeah.
FYI. Yeah, you're in the bathroom. It's like that's a great place to promote something, right? Anyways, sorry.
And so little things like that, they may seem insignificant, but it's the cumulative effect. So I liken this to like a flywheel. So a flywheel is really hard to get started, but once it gets going, it has a lot of momentum. And so tell us a little bit about or what do you think is the key to why an LNF member today, when you add something, they automatically look at it in a favorable light?
Really, it's all the legwork HR does. It's a lot of work. But I will say, HR and the company owners need to be very well linked up. HR needs to understand what a self-funded plan is and all these carve-outs, right? Like, they need to understand that, because if you don't, then you're like the employee. You're not going to be understanding. You're going to keep asking all these questions, like, why am I sending them there? It's probably just easier to tell them to use their card. It's the same money, right? No, it's not. Like, there's just so much more savings for the employer. And if HR doesn't understand that, it's going to be hard to explain that to the employee. So it is a lot of work, but I'd rather have all the employees come to me so I can effectively explain to them their benefits. Now I'm pretty lucky because I tell them to call Care Navigation. But I did some implementation with them as well, right? I had to get the Care Navigation team to understand what kind of culture we have, right? A lot of Spanish-speaking employees who they like Facebook, but they don't like doing anything on any other app but that one, right? Just as an example. They don't know how to look up, their paycheck. They do know, they just don't want to because they know somebody else can do it for them. But I take advantage of that space and explain benefits, right? It's just that.
I think the other piece of it too, in terms of favorability and how it's viewed, I think over a period of time, the level of trust, I think, has really increased. The more adoption that we get, they understand that, the La Mantilla family, they're doing this to take care of us. This isn't just a cost savings opportunity. Like, we're getting really great care. And then once that flywheel starts going, they understand that once a new solution is kind of enters the equation, well, again, this is the La Mantilla family taking care of us. And I think the incentives are important, and I want to talk about that because I know we're running low on time. I mean, incentives are key. I would say if I were to strip all this back, and yeah, it can be complex, but to make it very simple, I think there are three really key things that need to be done if you want to be successful in direct contracting. Number one, again, you've got to have kind of the right chassis to be able to transact in that manner, okay? And there's a lot of different ways that you can do that. We do it through a captive mechanism, but there are other ways to do it. But you have to be able to transact in that way, number one. Number two, embed proactive, human-centered care navigation into the middle of it. One number to call, one team to talk to, simplify the process for the member. Anything you need, call that number. Call Nurse Dora, call whoever it is. So make it really easy for the member to access. Otherwise, you may have 20 different programs and clinical partners in place. It becomes a complete disaster for them to figure out how to get there. So embed really proactive care navigation. Number three, introduce incentives into the process. Incentivizing the employees is a huge part of success.
Yeah, and if you think employees are going to take advantage of the $1,000, well, no, they need orders, right? And that's them calling Care Navigation to get like the right MRI, et cetera, right? Go through green imaging or whatever you need to get those orders. And then it's taken to Care Navigation, and then from there, they'll go to Sean's team, schedule everything. And so there's no way to take advantage of it.
So that we can continue with our schedule, we want to take a couple of questions, if we have any from the audience. Anybody?
Oh, come on, it was that straightforward?
Yeah. You're going to question Sean's NPS score.
Yeah, that's,
You guys have a really innovative program that you've put together, and if anyone hasn't read the history of LNF and how the things you developed, it's really fascinating. What do you think has been, this is from a dollar amount perspective is a lot, but what do you think has been the most successful of all the different kind of cutting edge things you've put in place to manage your plans?
Well, so there's several, but I think the one thing that I would hit on, there's a lot of really great clinical partners that we work with. They drive significant amounts of, from a savings perspective, surgery, obviously, imaging, the gamut. But I would say, my opinion, the most critical part from a plan operations perspective in getting all of this work done, the single most important piece of that is care navigation, right? Because again, utilization is really what matters in these programs. There's a lot of great clinical people involved. They can save us a lot of money. They can provide really high quality care. But again, if nobody uses it, it doesn't mean anything. It's all just, a wasted effort. And so that care navigation piece really becomes the catalyst to what these clinical providers can bring to the table for our plan.
And you can say, I'll just put an HR person there for care navigation. It's really hard if you have audits, reports, et cetera, right? I used to be that person. I was care navigation before care navigation.
And it was at 10%.
That's right.
No, it was higher.
Where were you on that one, Andres?
Yeah, sorry. But through a care navigation company, they have everything you hold for your employees as insurance. They just literally navigate for them.
So you would say your workload decreased with the
Yeah, oh,
implementation?
yeah.
Right.
For sure.
navigation optional or are they good?
It's optional, but we tell them it's best if they go through it, right? Because that's where the zero cost benefits.
If they're
right?
going to access the zero
Right.
cost solutions,
They need
gotta
to go through
care.
there. And they'll, if he doesn't go through it and I do, we both went for, I don't know, gastrointestinal stuff, right? He's going to get a $2,000 bill and I'm not.
Yep.
I have a
Go.
quick question. So if someone was interested in pursuing this through Texas Medical Management, what would kind of next steps be? And then I looked at your website and I didn't see any pricing for Dallas yet. It's coming soon. Is that still coming soon or?
Yeah, just so everybody knows, I'm sixth generation Houstonian, so Dallas is special. It has been a slog to get into Dallas. And I thought we were done like 6 weeks ago, and anesthesia pulled the rug underneath us. We got it done 3 weeks ago, and then there were some implant issues. So we don't post things until we are like rock solid. We stand behind it 100%. I've got ortho. Javier said this morning, our surgical nurse, it's this week. And so that's between today and tomorrow. So I'm real hopeful. But yes, it'll be there, and when it's there, it's good to go.
You're starting with orthopedics.
Do you, because we got to wrap up here, but do you have another option? In other words, is there a wraparound PPO if folks don't want this?
Yeah, so we do have a PPO
Yeah.
as well. And then we structure all of our direct contracts outside of that PPO.
Yeah,
So
and that's the point I wanted to make. Again, another example, like the 10th today, that you can have a PPO and take steps towards change. And that's what we're trying to drive here at HBCH. And then quickly, more to Sean, are the consultants going around just spreading the gospel for you?
I'd like to think they're doing so quietly because I don't hear about it, but I think it's between them and their maker. But
Well, I ask these things, are you hearing this from your consultants and your health plans?
Right.
To this particular point in time, and that pressure has to come from the employer side of the table.
100%.
in response to this young lady's question back here about what are next steps, we do direct contracts with self-funded employers. If the self-funded employer says, hey, look, I need you to work with my TPA, and TPA says, I think it'd be better that we have the contract, that's fine too. And then the care navigation that they put in place recently, that is like the best care navigation I've ever worked with in my life by times 100, is patient choice. And they'll say, we'll do the contract. Ultimately, I think the smartest employer health plans are going to own those contracts. Because as we've talked about on several of these talks, when the fiduciary starts coming up as an issue and lawsuits start coming, as an employer health plan, employer-sponsored health plan, having self-funded plan is great. Having direct contracts that you actually have high utilization means that you're actually doing something about containing the cost. And so I don't know about safe harbors and everything. That's usually kind of a legal thing that happens. But I think you're moving in that direction. You're doing it. You're walking the talk. Then I think, obviously, that's going to be better off than if you're fully funded, waiting for the government to come find you.
And another org that I've recognized that I wanted to have here for intended purposes. So again, thank you all so much
You're welcome.
Thank you.
for coming.
Appreciate y'all.
Thanks for having us.